people from all walks of life amidst the hustle and bustle for daily bread, achieving set targets, getting educated, and the likes. A never-ending cycle, it seems, until one breaks down in sickness, and suddenly, everything comes to a halt. The greatest wealth, they say, is health. So irrespective of your financial or material possession, our health is our most valuable asset. The government of Ghana, under the leadership of President John Agyekum Kufuor, in 2003, introduced the National Health Insurance Scheme, a pro-poor social intervention program aimed at ensuring residents of Ghana have access to quality healthcare without financial constraints. A step that will progressively help eliminate the cash and carry system of healthcare delivery in Ghana.
Before I was installed as president of Ghana, and through the elections that brought me to power, we saw that there was no policy for health delivery, and the cynical name given to what was in practice then was cash and carry, which meant that when people didn't feel well and they attended hospitals and clinics across the country, and they were even fortunate to get some doctor to examine, diagnose them, they had to pay for services, and where they didn't have money, they were denied service. But the whole idea was to stop the demeaning thing called cash and carry, which was destroying Ghanaians and denying citizenry of the healthcare service. So this was why we did it.
With the help of the then Health Minister, Dr. Kweku Afriyie, a policy document was created for parliamentary action.
Among other things, my mandate, without any equivocation, was to prepare a policy document and also legislation, because we decided that we would bring the health insurance by legislation, not by any administrative fiat. So I was to do all those things and then make sure that Parliament passes it.
So the bill that went to Parliament on health insurance needed dissemination across the country. So Deputy Minister in charge of that area at the time, I had to go around the country with two committees in Parliament, Health and Finance. We toured the entire 10 regions at the time, and I was speaking on the bill.
Taking the bull by the horns, the Nouvelle initiative by the government took off with a 5-member staff to sensitize the public. Claim submission was completely a manual process.
At the beginning, we only have 5 members of staff, including myself, and with different titles, but the same role, because it was a novel scheme and we were learning on the job, outreach programs, community publicity and all of that, just to sensitize people about the novel national health insurance.
So much as at that time, we only had a claims manager and a deputy, and claims were submitted directly to the office, that is manual. So I remember so well in 2005, even for Fanoche 3 months claims were only 12 claims. And those were the times that we were able to even visit clients and then ask them of the medication that they had, and then we pay accordingly.
The intention was to create a lasting policy that can withstand the test of time.
The concerns were that, having accepted it was a good idea, was it going to be sustainable? Sustainable in terms of financially? Sustainable financially meaning, is it going to be tax-based? Was it going to be premium-based? And if a premium-based, was the economy strong enough to support and contribute enough? Would people accept? The colleagues On the presentation of the facts and the studies and the evidence then, seemed to think that it was doable. Doable in a sense that the disease burden of the nation at that time, excluding the non-communicable diseases, quantified and aggregated and translated into financial burden.
As is expected of innovations, the NHIS's major challenge at inception had to do with identifying specific membership categories.
The first was really with how to identify and enroll members. And that had been a challenge for the scheme right from inception. Because as you'd notice, at the inception, it was intended that we had exemptions for categories that were considered vulnerable, which included the indigent, pregnant women, and so on. And how to actually look for them and enroll them was a challenge. Why was it a challenge? Because there was a means test which was, however, very difficult to implement. So how did we get around that? We started talking to the Ministry of Gender Social Protection. And we got to pilot a means of identifying the vulnerable. I believe that has continued until today.
There was also the challenge of Ghana being HIPC, but health was still a priority.
The economy was in HIPC, highly indebted poor country, with so much indebtedness. So it wasn't like the state was well off. The state wasn't well off. But then, what was government there for, if not to help the citizens to live? And health must be given priority always. So we stepped in to enable citizens to access healthcare affordably.
Mobile renewal was finally birthed as a sigh of relief for members and the scheme as well.
Now there is mobile renewal. Mobile renewal, we started thinking about it in 2014, 2015, when we had a study with the ILO. And the ILO had an agreement with us to actually post somebody to help us with that. Fortunately, the management continued with that after I left, and today you have the mobile renewal, which was started as far back as 2014, 2015. So that is on the membership side. Now to the provider side, the issue had been one of claims delays, which I think has persisted to today, maybe in a different form. But the question becomes, they give services to the members and then it takes so long to pay. It was a pain point for a lot of providers. They kind of voiced it. We tried as best we could. And one of the things that was responsible for that was the paper claim systems that we were operating. So how did we deal with it? We started, digitizing as far back then. And we came up with a solution called Claimit, which allowed providers to submit their claims electronically. I'm told that now it's been scaled up to 5,000 facilities, which I think is a very good thing the current management has done.
NHIS speedily gained recognition and membership grew in leaps and bounds, resulting in the challenge of longer waiting times at the district offices.
Well, we did some research that showed that one of the barriers to renewing was how long it took to have to go to our district office and renew every year. Our survey showed it's an average of 11 hours queuing. And then the transport costs, it's around 5 cedis per person to get to our office and renew and go back. That was becoming a barrier. And when we talked to the members, they said they want to do it themselves. That meant we had to think through how we could do it. And the best idea out of several was letting them renew themselves using mobile money.
A member of the scheme, expresses her experience with the digitization of the NHIS.
9 years ago, I was here and the pressure was too much. Initially, we came to meet a group of people, long queue. Some said you should leave Stone, others said you should consult this person before you can get your card. So I came and went back the next day and I wasn't able to get my card. And I came in the third day before I was able to get my card. So the card expired. So I didn't even come to renew it because of the pressure. I didn't want to go through so much stress, so I didn't come again. So coming back for a new card, I thought I would have faced a lot of challenges. But when I came and there was no line and a person came to attend to me, he just took my Ghana card, asked me to wait, and I'm almost done with my card. So I think there's been a lot of changes. So far, so good.
To prevent the scheme from going back to the dreaded cash and carry system, the regime of Dr. Samuel Anno in 2018 adopted the 4-pillar strategy to restructure the scheme for further gains away from the indebtedness the scheme had encountered as it grew.
I think when we came in 2017, beginning of 2017, we found the authority was undergoing so much strain in terms of outstanding indebtedness to service providers, and that had triggered in unauthorized payments that the service providers were collecting from our members, and that was threatening to actually push us back again into the original dreaded cash and carry system. So we had to put in measures to try and fast track the processing and the payment of all these outstanding claims with the help of President Nana Addo Dankwa.
From a membership base of 11 million in 2018, the NHIS currently stands at over 17 million members, representing around 55% increase and counting. Dr. Okoboy, the current chief executive of the NHIA, instituted a 5-point transformational strategy tagged 5Ds at 2D, with an overall objective of making the NHIA the most visible and reliable public organization with the most vibrant staff.
I think, first of all, I'd like to thank God for His goodness. We are all alive by His grace to witness the 20th anniversary of the National Insurance Scheme. It's important to start on the note after having thanked God to thank visionaries like His Excellency President John Ajay Kufuor, who conceived and birthed this organization. Let me also show my appreciation to all staff of the National Insurance Scheme. There are folks here who have been working for the past 19-20 years. All their life has been about health insurance. Some of us mean so well. We are talking about 5Ds. But I remember we started driving this NHIS bus just about 18 months, 19 months ago. But there have been passengers who have been around for 20 years. So we salute them. These 20 years, the theme is celebrating our heroes. It's about our legends. And so kudos are equal to all our staff. We are what we are because of our staff. So we talked about some 5Ds. We talk about development, we talk about digitalization, we talk about decentralization, data, and information dissemination. And the bottom line is to ensure that the National Insurance Scheme, if we adhere to these 5Ds, should become the most relevant and the most visible public organization in Ghana. In fact, not only in Ghana, but in the West African region. And it is very possible. Why am I saying so? We are one of the few organizations that provide service and cover almost the entire population. We take care of people before they are born at the antenatal clinic. We make sure they are insured. And we cover people when they arrive in this world, all the way to death. So, if we live up to our task, people will start to appreciate what we stand for. And that is not to say they don't appreciate what we stand for now. But people will start to appreciate all that we stand for as an organization. and that will go to inure our image and all that. Let me also say that we are not only in the position to be the most relevant organization, but the most visible. Not empty visibility, but presence of visibility with substance. Meaning our presence adds a lot to the lives of the ordinary Ghanaian. The theme of the National Insurance Scheme is your access to health. And our presence must define and show that really we have the access to health. So I'd like to thank you very much and like to encourage all our staff, and not only our staff, but all our stakeholders, the ordinary Ghanaian on the streets, politicians, the clergy, for all to come on board and see how we can work together to build and to form a sustainable organization that has presence and confidence, has the confidence of the people. Because when we stand well, all will stand well. When we do our work well, all will enjoy quality life in this particular country. And I'm caught on camera saying most of the time that your accommodation or shelter can wait, your food can wait. All this can wait without taking away your life, but your health cannot wait. And that is why we don't have the excuse to take chances. We have every reason to let the world know what we stand for, which is your access to healthcare.
The NHIS story has evolved with the changing times and is eternally grateful to the good people of Ghana for their support so far. But this story is far from ending, for together we can achieve more. Happy 20th anniversary to the NHIS.
So congratulations to all of us at 20 years, and I go to all our legends. Thank you very much.
I think on the birthday of the National Health Insurance Authority, I wish members, the CEO, his deputy CEOs, the whole management team, I wish them well for carrying on their shoulders this big efforts.
Health Hughes, 20 years strong. Happy 20th anniversary.
NHIS at 20. Hooray! Happy anniversary to us!
Happy anniversary NHIS. 20 years is big.
Happy 20th anniversary.